Okay, I don't know if I don't know. Okay, so we use 3 needle.
And the IT bend? Like
So T bend is this is tensor fascillator. It starts from the hip, from the iliac bone and going till the femur bone head and attached with here, and this all is T bend. Okay, so what you feel that is tip area. Touch here and see. This is T bend. Tight bend.
That's for abduction as well, no?
Yeah, this is helping abduction. So because
It's a
T bend is connected with tensor fascillatis.
Yeah.
So that's why we count the tensor fascillatis, not the T bend. Okay. So this is your femur bone. From femur bone to just come 2 tune or maybe 2.5 tune above. Again, so when you are inserting needle on the when you are inserting needle for the glute medius, go little bit 45-degree angle. But when you are inserting needle for the minimus, go around the 60-degree. So when you are coming like this side and insert needle here. Okay.
So now this is
Yeah. This is for the whole needle went deep. This is for your meniscus, and for the medius will come little bit this side and little bit top, because medius start from here on the iliac bone. Okay, and we'll go a little bit more superficially. This is enough.
that you have to go deeper
That's
because
the
underneath.
This is
That's
the
a
minimus.
medius.
This is the medius. Okay. Now this is the your tensor fascial type. This one is your tensor fascial type. So you can go a little bit cross like this. This is tensor fascial type.
Okay, now whether you like it or not, you're going
That's
to get better.
45 degrees, no?
Yeah, you can go because the tensor fascial type is like muscle like this.
Okay.
The flat
go
muscles
straight,
like
at
this.
least
And these
the bone.
ones are
This is the
straight,
more
no?
deep muscles. They have the thick muscles.
So otherwise this will hit
And
the
if you
bone.
want, you can go like little this. There's no problem.
Okay. But you can go direct, straight down for these ones as well. Okay.
But this one less deep because it is there on the top.
Because glute medius is the
on the
first
top.
layer muscles,
Yeah.
and minimus is second layer below the medius. So for if we want to insert needle inside the medius, then we
You have
have
to
to
go deep.
cross the full medius.
Yeah.
Understand? And tensor fascillatis is one top muscle.
So that's not a problem.
Yeah. So if you give the electro this after that, if you see the flexibility, one of the this joint
40.
which is responding very fast.
60.
Okay. After that, immediately patient feel, oh my God, good mobility and.
Of their hip is it?
Oh, so that means Padmasana I can do after doing this.
Yes, maybe you can try it.
Because I can't do Padmasana properly, but I can.
I don't know which is Padmasana, but
Padmasana
if
is
it's
the one
moving
you.
the joint, then you
the
can do it.
posture
Oh yeah.
That one, no, double one. That
Okay.
normal is
Lotus,
Sukhasana.
that's lotus.
No.
Yeah,
That's
lotus.
lotus.
Lotus is Padmasana.
So people
Lotus means
this
Padma.
condition, this is
That's the English word in Sanskrit.
These conditions,
yeah, this
the adductor is
So
mostly.
lotus is
will come on the adductor.
Sukhasana, which is just normal folding. Is easy. That we do it all.
This is medius, tens ಇದು
Minimus.
minimus. This is maximum,
Yeah,
gluteus
maximus is
maximus.
here. This one is maximus. What we are
Maximus
pressing
never
every
requires
day. That is maximus,
Maximus.
right?
So it's never weak.
Rarely required.
No, it's become the weak, but
Okay.
steepness is very
Oh,
difficult.
sorry,
there's
stiffness.
many people that there's no strain in glutes.
Yeah, glute
Tenses.
weakness is very common.
Okay.
Steepness,
Never.
because if there is mild steep, you are going to sit. You are pressing acupressure point. So
Yeah, stiffness is not.
steepness is not. Some case which is the they really having the like very heavy constipations.
They
Okay,
have stiff.
these people having the steepness in the glute muscles.
Like that man that day yesterday who was telling you that he had piles and all. He was telling you, no, in Rajasthani that 40 minutes it takes me inside. Like I keep sitting
Yeah,
and I'm heavily constipated.
Yeah.
So even he was telling me that he has pain here.
Sometime, for example, sometime glute maximus pain is comes from your slip disc and nerve related. So don't compare that is a glute pain. Okay. Glute pain mostly travel from the here. The patient will feel the on the iliac bone pain here. For example, the glute muscles will pain here more.
Yeah.
Okay, which one? Glute maximus, because maximus is connected with the three bones. So they will pain more here and here. But glute medius and minimus, they both are connected with only
Two
two
words.
bones. So they will feel the complaint pain more in the hip.
In the hip.
There is one disease, I don't forget the name. In that conditions, the capsules of the femur bone become dry and start to degeneration. The femur capsules, necrosis. So that is the stiffness of the glute muscles. And glute becomes more stiff, no? They are pressing two bones, and each and every day the bone is starting to touching each other, and the capsule will start to start damaging. Okay, that is it. In that condition, we do the one needle inside the joint. Okay, patient is lying down like this, and we'll go needle here. Alright, mostly first we release the muscle stiffness. That is the more important. When we release the muscle stiffness, then we slowly we are going to target inside the capsule.
Basically, if you keep doing yoga, your chances of messing up reduce.
You can open one center here. Yeah, of course.